And those are some of the headlines. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Sharif Abdelkadous.
And welcome, everyone, and welcome to 2010. As Congress gets set to reconvene in the new year, the fight for healthcare reform is at the top of President Obama's domestic agenda. The House of Representatives is scheduled to return from vacation on January 12th and the Senate on the 19th. At issue for both chambers is how to merge the two bills that differ on substantial issues that include financing and the inclusion of a public option, among many others. Democrats are hoping to get a final bill to the president's desk before the State of the Union address in late January or early February.
Today we spend the hour with one of the most influential health policy writers in the country. Dr. Atul Gawande is an associate professor at Harvard School of Public Health and is a practicing surgeon at the Brigham and Womens Hospital in Boston. He's also a staff writer at the New Yorker magazine. We'll talk to him about an influential article on healthcare costs that was cited by President Obama and became required reading at the White House. Healthcare systems in other industrialized countries. We'll also talk about the effect of solitary confinement on prisoners that he's written about, and much more. But first, Dr. Gawande is just out with his third book. It's called The Checklist Manifesto, How to Get Things Right. Dr. Gawande, thank you very much for joining us.
It's great to be here.
The checklist, what do you mean?
Well, in all of my writing, I'm interested in where the individual meets systems. And in medicine, what I've noticed as a surgeon is that we have become overwhelmed by complexity. We have trouble getting things right because the volume of knowledge we've created in science has overwhelmed our ability as individuals to follow through. And we've seen ideas like use a checklist as a sign of weakness. We've not gone where aviation has gone in embracing these kinds of ideas. But for people on the receiving ends of care, they see the gaps, they see things falling through, and we've been slow to embrace some of these very simple ideas.
And what do you mean, the checklist?
Well, I tell the story of our effort to address the problem of deaths in surgery globally. Surgery is exploding around the world. People are living longer, and it's not just infectious disease that's now harming people. People need care for cancer, need care for auto traffic accidents. 250,000 people get an operation each year, and we have over 1 million who die from complications. Half we know are avoidable. So what do? Our usual approach? More technology, or train people longer and longer. I went through 8 years of training to become a surgeon, and yet I still see mistakes every week. So we decided to try something new, which was a checklist. We worked with Boeing to learn how they made checklists for cockpits. We made a 2-minute checklist for operating rooms. And when we implemented it in 8 hospitals ranging from rural Tanzania to Seattle and London, the average reduction in deaths was 46%.
Almost half.
Almost half. And, you know, I started using the checklist in my operations at Harvard only because I didn't want to be a hypocrite. We were implementing this in lots of other places, but did I think I needed it? No. I haven't gotten through a week where using a checklist that said, did we get the blood ready? Did we get antibiotics in? Also, does everybody in the room know each other's names so we're working as a team? We have caught problems at least once a week, sometimes every day.
And why do you think this is so effective? You also tell the story of Johns Hopkins, how they implemented a checklist for central line intravenous, inserting central lines. Talk about that and why, as you said, after 8 years of training, something as simple as a checklist will help you avoid these mistakes.
Well, and I think this is where it connects with our thinking about this moment where we're really trying to reform our health system. We've gone from a world where we thought penicillin is the kind of solutions we will have in medicine to a world where most of us will spend some time in an intensive care unit at some point in our lives. The average American will have 7 operations over the course of time, and every one of these are incredibly complicated. We've trained people under the assumption that what professionals need is to have it all in their heads, that we're just going to remember everything. We now have 13,000 diagnoses, 13,000 ways the human body fails, 6,000 drugs, 4,000 medical and surgical procedures. We're trying to deploy them community by community across the country. We're having financial trouble doing it, and we're having trouble making sure it's safe and right. And that requires a new way of thinking, recognizing that we need some simple remedies, like checklists. If you have a new cancer, a new depression? Why can't we make sure we've identified the half dozen things that we should make sure happen every time, no matter where you are, in the country or, I would argue, in the world?
And you write in the book, you go back to the 1930s and the development of a new type of bomber and really the transformation of the airline industry and of checklists. Can you talk about that story?
Yeah. This was the moment when we went from saying, hey, in aviation, whatever goes, goes, to recognizing that something needed to change. And that moment was in October 1935 when the Army had issued a request for new long-range bomber designs. Boeing came out with a design that put 4 engines on the plane. Before that, planes only had 1 or 2 engines. And so this thing could fly higher, farther, faster, 5 times the payload of previous airplanes. It clearly was the plane they wanted. There was a flight competition. This went up in the air and then immediately crashed, killed 2 crew members. They did an investigation. Nothing mechanically wrong with the plane. The pilot had forgotten to unlock the elevator controls that would allow the plane to level out, and so it just climbed and climbed until it lost air and crashed. When Boeing lost his contract, nearly went bankrupt, but made half a dozen planes, pilots said, we think we can fly this. But their solution wasn't, let's throw more money at more technology, or let's train people for a gazillion years longer. They just made a checklist, a before takeoff list, to make sure that nothing critical was forgotten. And with it, they flew almost 2 million miles without a single mishap. We've hit our moment. Well, what they recognized was that plane had become too much airplane for one person to fly. We've hit that moment in a lot of components of our society. We've hit it in medicine. We're hitting it in fields like how do we deal with homeland security. And our troubles are that we don't try to learn. We don't try to understand how you make teams work well. And there's a science to this. There's not just a science of discovery. There's a science to how to make sure people at the front end know how to do the best possible things for people.
We're going to break, and then we're going to come back to this discussion. Our guest is Dr. Atul Gawande. He is a surgeon at Brigham and Womens Hospital in Boston, and he's the author of a new book called The Checklist Manifesto, How to Get Things Right. This is Democracy Now!, democracynow.org, The War and Peace Report. We'll be back with him in a minute. Here on Democracy Now!, democracynow.org, The War and Peace Report. We're broadcasting on over 800 stations, on Pacifica and NPR stations, on low-power FM, college and community radio stations, on public access TV and PBS TV stations, and both TV satellite networks, on Dish Network Channel 9415, Free Speech TV, 9410, Link TV, and on DirecTV Channel 375. And we're video and audio podcasting at democracynow.org. Our headlines are also available in Spanish for any radio station to take as over 250 are. And you can read the transcripts of every show on our website at democracynow.org. I'm Amy Goodman with Sharif Abdel-Quddus. Our guest for the hour is Dr. Atul Gawande. He's a surgeon at the Brigham and Women's Hospital in Boston, and he writes for the New Yorker magazine. His latest book is called The Checklist Manifesto, How to Get Things Right. And we're talking about checklists right now. From the plane to the first story you tell in your book about